Hi, I'm Joel Vilensky. I teach anatomy at Indiana University School of Medicine. I've been teaching freshman medical students there for 31 years.
And I'm Stephen Carmichael. I'm Professor Emeritus at Mayo Clinic. I was on the staff at Mayo for 25 years, taught first-year medical students and surgical residents and other interested healthcare professionals.
I was an undergraduate at Michigan State University. I did a master's degree in anthropology at University of Chicago. I got a PhD also in biological anthropology at University of Wisconsin, and then went on to do a postdoc at University of Iowa in neurology and anatomy, and then came to Indiana University.
And I actually want to start with my high school, because I went to high school in Modesto, California, with a fellow who did a movie about our high school called American Graffiti. That was very popular, but then his movie after that was called Star Wars. He's done very well. Then I went to college in Ohio at Kenyon College, graduated with honors in biology. Then I went to graduate school at Tulane University in New Orleans and got a PhD in anatomy in 1971.
Well, we have a book on comparing normal and pathologic anatomy, mainly for freshman medical students, although it also could be used by, certainly could be used by residents and medical students doing radiology. The important difference we made in this book is that it had always been, every radiology book before this had always presented pathology without ever presenting what the normal image looked like. So, and as anatomists, when we looked at this book, we said, well, how are they going to recognize pathology without knowing normal? So the big difference of this book, the value in that of this book to people, students learning radiology, is that we show normal and show abnormal, because you cannot recognize abnormal if you don't have an image of your head of what normal looks like. And we really thought this is I mean, it seems simple, but it's key to understanding and learning radiology, and we hope students, we hope we can quicken the process for students to look at, look at cross-sectional images in anatomy.
And just to amplify slightly on what Joel just said, a big part of radiology is pattern recognition, and there's a pattern to the structure of the normal body that one needs to recognize, and an experienced radiologist recognizes it, seems to me, instantly, and then a pattern to certain diseases that they also recognize with experience right away. But this is, our book is designed for the beginning stage, so it's elementary in terms of just a typical normal anatomy as seen radiologically compared to a pathologic image.
The book we just talked about is Medical Imaging of Normal and Pathological Anatomy, and the first book is Netter's Concise Radiological Anatomy. And that book, the premise of that book, which both books were done with a radiologist, Ed Weber, and one day Ed was walking out of my class because he teaches for me and said, you know, the students, and he was noticing some of the difficulties students had learning radiology, and he said, the students know Netter's and Atlas so well, why don't we just take radiological images and match them to the Netter's, to the place in Netter's Atlas, so they can easily relate radiological anatomy to dissection anatomy, the plates that are in Netter's anatomy, which Netter drew. That was the premise of this book, and I think from my perspective, from what the students have said, they really appreciate that. And we are going to be adding ultrasound images to that book in the next edition, because ultrasound is now growing in use in both in medical practice and in medical education.
And again, to amplify a little bit on what Joel just said, Netter's drawings are idealized. A real anatomic dissection doesn't look that good. And people who've dissected and looked at Netter's know what we're speaking about. So we're comparing these idealized images that Frank Netter drew with real images from real patients. So it's going to be the corresponding image that corresponds to this idealized figure with a real one. And the other thing I want to add is I had the privilege of meeting Dr. Netter back in 1989, which was a real thrill for me.
So our book the radiology shows living anatomy, where Dr. Netter's drawing is idealized, schematic to some extent.